diseases of the oral cavity or the mouth. The study of diseases affecting the oral cavity. Okay, a disease in the mouth is just like any disease. A response of a living organism to injury. Disease usually occurs with some level of the cells going haywire. For disease to occur, there's three conditions that must be present. Okay, if any of these aren't present, then you probably won't get disease. And the three things, the first one, you have to have a host or a cell, either or yourself, the cell or something that is susceptible to that, whatever it is, to that virus or that bacteria or whatever. So you have to be susceptible. The way it gets in, or the portal of entry for the pathogen, has to be present. Okay? So somehow that bug has to get in. You either swallow it, you breathe it, it splashes in your eye, you cut yourself. Somehow there's got to be a way for that bug to get in. And the other thing is that that bug has to be strong enough or stronger than your defense system, or the cell has to be, doesn't have defenses for that bug to get in there and cause any damage or start a reaction. Okay, so you have to be susceptible. There's got to be a way for that bug to get in, and then your immune system or that host has to, or the bug has to be strong enough for it to cause damage. So those three things have to be present for you to have disease. Okay, so one part of disease in the oral cavity is inflammation, okay, or how it starts. It's a response. So inflammation occurs as a response to injury, whatever it may be. Its purpose is to destroy the irritating agent and remove it and the byproducts from the body. If the removal is not possible, then you get that inflammatory response, which limits the spread of the agent to other parts of the body. So the inflammation is just the body's response to try to keep that inflammation in that area. Okay, if it doesn't happen, then it could spread otherwise or other places. Inflammation is also the mechanism for repair or replacement of tissues destroyed by the causative agent. Okay, so there's different types of inflammation. Okay, there's local. Local meaning in one spot or in one area. It's not spreading. It's limited to the area of injury. So if I come here and I'm walking and I go boom and I bump my head, where is it going to be? I'm going to get a bump and a red spot right here, locally. Okay? I'm not going to get swelling on my feet, unless I really do some serious damage, but normally it's going to be local. It's going to be one spot. Okay, so local to the area of the injury. If I cut myself right here, I'm going to get redness and a little bit of swelling, inflammation where I cut myself. Where you get a sting by a bee, it's going to be, unless you get an anaphylactic reaction to that sting, but locally you're going to get an ant bite or something, a mosquito bite in that spot. Then there's systemic, where it goes somewhere else. So if I hit myself really hard and then knock myself out, then I've got things going on other places as well. But systemic means it's not limited to the site of injury. Okay? Like a bee sting, if you're allergic to bees and you get stung, then that's a systemic reaction. You go into an anaphylactic shock, you get an allergic reaction to that bee sting systemically, not just a little. Okay, you get local and systemic. Know that difference. The other one is an acute inflammation. Means that it's immediate. Okay, anything that's acute means immediately. Something, again, say you get stung by the bee and you immediately start to get that allergic reaction. That's an acute response. Okay, so it's causing changes throughout the body instantaneously. Okay, and then you have chronic. Chronic means spread out over time. Anything that's chronic means it's spread out. Slow, ongoing process. Gum disease is a chronic disease. Diabetes is a chronic disease. Even, you know, heart disease is a chronic disease. Unless you get a heart attack, you get an acute myocardial infarction. That's why they're called acute, because it's right then and there. Okay, but you can have chronic heart disease over a period of time. Okay, regeneration and repair. It's common sense. You cut yourself, your body tries to heal. It's going to regenerate and try to repair itself. So there's a process of inflammation. It starts to send, you know, cells to clean up the bad bugs, and then starts to send other cells that start to clean up and repair. And then finally, that big cut, you just get a little scar and you're all healed up. Okay, so it's kind of the same process throughout the body, the same thing. So regeneration and repair. Okay, those are, I think it's multiple for matching. I could use those. Okay, so again, what is this? This is gingivitis. This is a chronic inflammation. You know, if somebody doesn't brush their teeth, you've got bacteria, you've got bugs, the gums are susceptible, that patient is susceptible, so you've got a response that you've got gum inflammation or gingivitis. You let it go, it advances to more advanced gum disease. But again, this is a chronic disease. You brush your teeth and you can make it all healthy by getting rid of those bugs. Okay. Again, inflammation. Okay, hyperplasia, you don't really have to worry too much about, but it's just an overgrowth of any tissue. Hyper means more than, and plasia is just tissue. So overgrowth of tissue during the repair process. Why it happens, they don't know. A lesion, again, anything that, a cut is a lesion, a sore is a lesion, a black mole is a lesion. Anything in medicine that you're referring to, we're referring to, you know, a white spot on the tongue, a lesion on the side of the tongue, or if we look at our x-ray, at the end of the root we see a radiographic lesion. So anything, any disease, we refer to it as a lesion. Okay? Okay, so the types of lesions, again, there's wounds, sores, an ulcer, a canker sore, again, it's a lesion, or a tumor, if it's bigger, is a lesion. Okay. So lesions that go below the surface. Okay, you can have lesions above the surface, you can have tumors below the surface, but they're all, or below the bone that we see it on an x-ray, that's a lesion. Okay, but any lesions that are below the surface. Okay, an ulcer is a defect that varies greatly, and these guys are, again, matching, I think. Okay, so know these guys. An ulcer, you guys have probably all had ulcers on your lip or on your gums because you hit yourself with a toothbrush, or you were out in the sun too long and you had a little fever blister. Those are all sort of ulcers. It's a defect that varies greatly in size and presents as a break in the continuity of the mucosa, similar to a crater. Mucosa is the lining inside your mouth. Okay, the lip, the cheek. Okay, that's called as mucosa. Okay, so it's similar to a crater. So it's below the surface. So if you look at that, that's like a little, those hurt.
What is
Mucosa is just the lining, the covering of the line, and I think we cover it a little bit later. But mucosa, yeah, it's just the oral cheek, inside of the lip.
So it's like when you bite your lip.
Yeah, you could either you bite your lip, or you bump with your toothbrush, or a canker fever blister. Could be a herpes virus or something, but they're all kind of little ulcers. Okay. Which is a break. It's a break in the skin, so it goes down. Okay. Erosion. This is similar, but this is caused by a mechanical trauma, and it's a shallow defect of the soft tissue. So something like this. You know, the patient comes in, he knows he's coming into the dentist, and he wants to get a good checkup, and he scrubs too hard and he erodes the gum tissue away. So that's erosion. So it's not as deep as a ulcer, but it's just kind of shaving away the top layer of the tissue there. Okay, so that's erosion. An abscess is a localized collection of pus. Okay, an abscess is a localized collection of pus in a circumscribed area. Okay, so this little kid has an abscess on those front teeth. That's a big abscess, so he probably bumped his teeth, and when he was little, fell. We had a little girl, Dr. Cervantes had a call over the weekend. The mom is my patient, but he was on call, so he saw a little granddaughter. She fell and hit her front teeth on like a coffee table or something. Now she had a sore, she had a red area up on the gum. It hasn't developed into this, but the trauma may cause it to turn into that. Because the teeth will die just from the trauma.
What happened to my daughter? Her teeth went up.
Yeah. So and actually on her, it looked like the tooth was broken. It looks like it wasn't loose, but it looked like there was a crack on that patient's. So she hit it pretty hard. And at that point, we really, if it's not really loose, just leave it. And again, baby teeth and young teeth have a lot of blood supply, and so sometimes they survive. So you just leave it and see what happens. But
what do you do about the abscess, though? If that's
this tooth, you can see how yellow it is right there. That one, we can, if the patient lets us, which sometimes they don't, we'll just pop it and then put it on antibiotics. And you just lance it right. And this one, if you just nick it like that, it'll just gush. But we'll put them on antibiotics, and then these teeth will probably, one of these teeth may be dead, and it'll need a little, like a baby tooth root canal to try to hold on to that tooth. Okay, so a cyst is similar to an abscess, but it's filled with fluid and or semi-solid materials. But the important thing is between a cyst is that it's an epithelial lined sac. Okay, so around that cyst, you'll see, if you take an x-ray, or if they go in to clean out the cyst, there's a lining there. There's like tissue around that, an epithelial tissue. Okay, so you can see this white border right here. So this isn't really an abscess, this is a cyst. Okay, the abscess you would just see without this white border. It would you'd just see like a hollow space. So this one, you'd have to do a root canal, but then the oral surgeon would have to go in there and scrape out this lining. If you don't scrape it out, it's not going to heal. So they've got to take away that epithelial lining. Okay, here are big cysts from third molars that weren't removed or that stayed impacted. You can see this big cyst all the way around here. You can see the impacted third molar up here.
That has to be painful.
And those, they have to go in there, take out that third molar and scrape down. If nothing's done, then the jaw can break here. I mean, because this is just a big space. I had a patient like this a few years ago that he came in and they really don't know anything until they start to maybe feel a little sensitivity, maybe a little tenderness or a little swelling. And you take a Panorex and you see that big. So luckily the jaw hadn't broken there. Again, here's a cyst back here. An impacted wisdom tooth. And that's why sometimes, wisdom teeth, we want to take them out. Because any tooth that doesn't fully erupt has the potential to form a cyst. They don't always do, but they can. Okay, so those are below. Lesions above the surface. Okay, you've got a blister. If you get a blister, you pinch your finger on the door, you'll get a blister. It swells up. And they're usually filled with a watery fluid. If you pop a blister, you get like this little clear liquid. Okay, so that's a blister or a vesicle. Okay, and you get these inside the mouth. Again, a little plugged up salivary gland that's not draining, you'll get a little blister. Okay, or vesicle. Sometimes those are called blank. No. The fluid on the lip. It'll come to me. Pustule. pustule is like a blister, except it's what?
Same
Full of pus. So pustule is like a blister but full of pus. So kind of like that abscess, you could call that, that's an abscess, but it's a pustule because it's full of pus on the little kid that we showed. And here's another one that's full of pus. So that spoke too soon. There it is. Okay, hematoma. Heme means blood. Okay, so hematoma, again, it's like a blister, but it's full of blood. Okay, either on the side of the tongue, or, you know, this is underneath, there's a, you know, tooth trying to erupt right there. Or may have been from the trauma that they took that tooth out. This Cervantes' patient. Okay, a plaque is a patch or a flat area. It's raised slightly from the surrounding tissue. Okay, and there's white plaques and there's red plaques, but a plaque is just a patch. Okay, could be on the tongue. That's a white plaque. That's how we would describe it on the notes. A white lesion, plaque-like, you know, extending from the, you know, distal lateral border to the anterior 2/3 on the left side of the tongue, something like that. So if it's a plaque, it's not an ulcer because it's not cut into the tooth. It's a plaque. Okay, or you can have it on the skin, plaque psoriasis. You see that again? Just plaques are slightly raised. Could be different colors. Lesions even with the surface. Ecchymosis. Okay, that's just a fancy name for a bruise. Okay, you bump your head, you're going to get a bruise. Or you give a shot, or you bump your chin. Sometimes after, you know, having all the teeth extracted on the bottom, or you hit a blood vessel with your injection, you can have that. And I've had patients that, you know, not too many, thank God, in 20-some years, but I've had a few patients that come in and they'll have like a bruise. And it's just when you give blood, sometimes your vein pops, you know, and sometimes inside when we're giving an injection, we don't see it, but you know, a day or two later, the patient comes back and they've got like a bruise. I've lost one patient to that. You know, she came back and cried. Oh, I'm sorry, I didn't mean to do it. You know, it's just one of those risks that we take when we give injections. And oh, but everybody just stares at me and they think my husband beat me, and it was like, oh my God. So she had a few more issues. This was 2 or 3 years ago. And she came back, and I think it was the upper left side, and I never even realized that I had done it, you know, because you don't, it's inside. But she came back a few days later, and she had like bruising on the side of her face, and I think she had some.
There's a lot of bruises. Like I bumped my leg, and like 3 days later, there's a giant black spot on my.
Well, that's.
And then I just like tell my husband, how much harder you beat me.
Yeah. Well, that's what this lady came by, and she said, "Oh Lord, everybody just stares at me in the supermarket, and I feel so bad for my husband."
Why does she even think that?
Yeah, exactly. So anyway, I never saw her.
Probably because it was on her face. Mine
Yeah,
are all on my legs, like all.
I know, but there's like so many other things that can happen besides your husband beating you.
Exactly. Yeah, but so anyway, I apologized. I said, I'm sorry, it's going to go away. You know, it's going to take a few weeks, but it's going to go away. I couldn't do anything. It's not. So I've never seen her
Every
back.
time I ever went to the dentist, so after they would just tell me, make sure you put a little cold compress on the area we worked on to prevent like bruising or whatever.
But it can happen, or you know, the site of an injection, you'll get inside the bruising underneath it. Lesions that can be raised or flat. You've got nodules, small solid lesions detected by touch. Okay, sometimes on kids or on adults, you'll feel in the back of the neck, and you'll feel little bumps. You know, and that's a nodule. Okay, and you've got a mass growing underneath that causes it to be raised up above. Okay, granuloma is a type of nodule containing granulation tissue, which is kind of a reparative tissue. The body's trying to repair whatever's causing that. Okay, so here on this patient with braces, you got little granuloma in between the teeth there. A tumor or neoplasm is any growth of tissue that exceeds normal form and serves as no useful purpose to the host. So again, a tumor is just, again, cells just going haywire. They're not doing any good. They're just growing out of control. There's benign tumors, which are non-life threatening, and then there's malignants, which are a threat. Okay? There would be a malignant one on the side of the tongue. Dental caries. Okay? Again, it's a lesion. It's a disease caused by bacteria and their byproducts. Found in dental plaque, the bacteria causing dental caries is Streptococcus mutans and Lactobacilli. Decay is the destructive process of the tooth. Okay? To control caries, you've got a brush. You either have to remove the plaque, you have to take a lot of fluoride to make your teeth stronger, or the biggest one is your diet. Okay? If you don't have too much sugar in your diet, you rinse and brush, you're going to minimize and control your decay. Again, you've got to have this system there. You need the bugs, microorganisms, you need time, you got to let those bugs sit on your teeth for a while, you need to eat carbohydrates or sugars or whatever, and then you need teeth, and then they're all inside covered by saliva. So any of those that are missing, you probably won't get decay. Okay. Stages of dental caries. Okay, there are different stages. Stage 1 is a smooth surface caries, triangular in shape. Decay that usually occurs between the teeth, below the contact area of the teeth. Okay, so if these are the two teeth, it will occur below the contact. I'll show you. It's not a test. Yeah, probably below the contact. The broad area of decay that takes place. I'm trying to remember I don't remember what the question is. But anyway, it's just a small. I think this is in your book. Towards the back. It's usually just barely breaking the enamel, and it's a little triangle as it starts to break through. So right here, right on the side, there's a little triangle. And that's stage 1 caries, just barely breaking the enamel, and then it starts to spread. Okay, so when we look at these white lesions right here, okay, if we were to take an x-ray sideways, we would probably see something like this here, that's a little triangle. Again, here's the contact, and right below the contact, you'll see that little triangle. You probably wouldn't fill that, because it's not broken through into the enamel yet. You can barely see it right there. If you blow it up, it's right
You
here.
have to take fluoride to make that stronger?
Yeah, fluoride, recommend fluoride,
My daughter
flossing.
has that.
Well, it probably won't go away. It'll just keep it strong. The white patches won't go away. That's already demineralized. You just need to keep it clean and keep stuff from staying on. How old? Your daughter?
She's 10.
Yeah, so it's on her permanent teeth already.
Mm-hmm.
Now, it may or may not be. That may just be some staining on her.
That's what one of the dentists said, that he thinks it's stained.
Yeah. It may or may not be decay. It may just be the way the teeth are. It may just be demineralized enamel. And you just have to keep it clean. Okay, fissure caries. Again, the fissures are the deep areas inside the teeth or on the biting surface of the teeth. They are diamond shaped and occur on a occlusal surface. when we take x-rays of the fissure caries, you really can't see it. Those you have to diagnose clinically. When you take a picture of these occlusal areas, you can't see if it's decay or not. Okay, so this is usually clinically when we see these fissure and it caries, and you clean them out and you put them in film. Okay, stage 2, the decayed triangle is still confined to the enamel, okay, but has passed the halfway point. So on the first one, you just broken through. Stage 2, then you're still in enamel, but you're past the halfway point, starting to get to the dentin enamel junction, okay, the DEJ. Here it says fillings performed at this stage may remain on the enamel or extend into the dentin. You know, again, depending on the patient's hygiene, if they're really good at hygiene and they just have some demineralized area, I normally just watch them and put them on fluoride. When I fill them is when they actually break. So if you look at these here, again, this one's approaching, about the halfway, and that one's approaching the halfway. So those probably would be stage 2, stage 2. Once they break through the enamel, then we're getting into stage 3. Okay, once they break the enamel and enter into the dentin, okay, then we're stage 3. That's when you have to do a filling. Okay, because once it spreads into the dentin, it just kind of starts undermining. So this decay must be removed and a restoration placed. If you look at or cut a tooth sideways, you can see this fissure coming here. And you can see it's already broken through the enamel, and you've got decay down into the dentin. Again, enamel, then here's the dentin enamel junction, and you've got dentin down here, which is the main structure of the tooth. Okay, so again, this guy here would be stage 2. It's already broken through and into the dentin, and just barely into the dentin, not quite halfway, approaching halfway there. Okay, then stage 4 is once it passes the halfway point between the dentin enamel junction and the pulp, which is the nerve. So after you break through the enamel, you're into the dentin, you pass halfway, then you're stage 4.
Are these matching? Are they matching?
Yeah. I think they're matching or multiple choice ones. Okay, so this one here, again, you're past the halfway. Here's the pulp canal, or the pulp chamber. Broken through the enamel dentin junction, you're past halfway here. And here's it is on the x-ray. So even on the x-ray here, it doesn't look, it looks a little bit further away here, but when you actually get in the mouth, I mean, we're cleaning out all the way to here. So that looks better than this picture. Again, this is class 4 here. That's almost into the nerve here. That's too late on that one. We're doing a root canal. And this one may even need a root canal. Okay, so root canal, once it gets past stage 4 and you're into the nerve, the only way to save, you only have 2 choices. You either take the tooth out or you try to save it with a root canal. And we'll cover a root canal later on, but those are the stages. So stage 1, just barely into enamel. Stage 2, approaching the halfway point. Stage 3, you're past the halfway point of enamel. Stage 4, you're into the dentin at the halfway point of the dentin there. And then you've got a root canal. Okay, like this guy right here is way too late. You're into the nerve. So you're doing root canals on these guys. So that's the root canal material. Okay, diseases of the oral soft tissue. leukoplakia is a term meaning white patch. This condition can occur anywhere in the mouth and is usually painless. To be characterized as leukoplakia, the lesion must be firmly attached, because there are some lesions that you can wipe them with your 2x2 or your gauze and they come off. Okay, leukoplakia, you wipe it and it doesn't come off. The cause is unknown. Could be caused to chronic irritation or trauma. Sometimes you have a patient who has a broken filling or a broken tooth and they haven't fixed it, and so the tongue or the cheek is rubbing on that and they'll get a patch, and it's kind of like a body's trying to protect itself, building extra tissue, and you get this white patch. But it's important to diagnose it, because if it continues to be irritated, it could turn into a bad lesion there, a malignant lesion. So something like this, okay, under the tongue, leukoplakia, wipe it and it doesn't come off. So we would tell the patient, you've got this lesion underneath there, it's white, it's not supposed to be there, I need you to go see Dr. Kaiser or somebody to take a look at that. Okay, on the side of the tongue again. Anytime we see something that's not supposed to be there, we just inform the patient and refer them out. Unless you do your biopsies yourself, then you can do the biopsy, but usually we send them out. Okay, lichen planus is sort of like leukoplakia, but has a little different appearance. It's benign, chronic, means it's all there, for a long time. Disease of the skin and the oral mucosa. The white patchy lesions has characteristic patterns of circles and interconnected lines called Wickham striae. These erosive lesions tend to flare up with emotional stress, but their cause is unknown. Okay, so if you pull the cheek out, you'll see these little kind of lines that go up. That one's not so clear, but you can see this one here. Okay. Again, don't know what causes them. And sometimes you wipe it and it's just like it rubs off. Just kind of stringy.
How do you treat it?
Steroids.
Steroids?
Yeah.
Emotional stress. Okay, candidiasis, a superficial infection caused by fungus. Okay, Candida albicans. This is the most common oral fungal infection. Candidiasis usually occurs more frequently in immune-suppressed individuals, those undergoing antibiotic therapy, or those with diabetes. The infection usually occurs with pain and bad breath, and they really can't taste food really well. Okay, this is a denture patient, that redness up on the palate there. Probably not keeping the denture very clean. And this, you give them either some lozenges to take care of it. Pseudomembranous candidiasis is a different form of candidiasis. It's characterized by white, creamy patches, kind of pus-like. The individual frequently complains of burning sensation or unpleasant taste. The white patches do rub off. Okay, these guys, they go all over the mouth. Aphthous ulcers, again, these we sort of talked about a little bit. Those canker sores or breaks in the gum or the lip, common form of oral mucosa ulcerations. Okay, so you've got recurrent aphthous ulcer, so RAU, a disease causing recurrent outbreaks or blisters on the lips or the mouth. It makes eating or drinking difficult, like we talked about. You can put topical agents if you want for pain. Sometimes it's just better. Nothing's going to get them better, only time. So just taking an Advil or Tylenol for the pain. Sometimes you could put topical steroids on them to minimize the discomfort. then so you've got minor ulcers, usually 90% of the patients, and they usually last 7 to 10 days. And you'll get the patient who comes in about day 4 or 5, and they say, "Oh man, like, it really hurts, it really hurts." You pull the lip back and you'll see that. How long has it been? Oh, it happened on Saturday. And it's usually day 4 or 5, and that's when it hurts the most. I mean, if you've had them, and you can't even lift your lip up because they're so tender, and you eat and it burns, and you put your tongue in it burns. They usually last 7 to 10 days, and after day 4 or 5, then they just feel better, and then they're gone. So really nothing you do about them. You know, take some medication. If it's really bad, if they have them on multiple sides of the mouth, we can give them a mouth rinse that has a topical anesthesia and some steroids on it, and they can do that if it's like on their tongue and they really can't.
Is that like that? My son had this once. So I took him to the emergency room for a fever, and the little girl next to the room had like that something in her mouth. They call it like the hand and foot or something, where it was all busting out like
hand
that.
and foot disease.
Yeah, and then they put him in the same room, and then he got it because it's very contagious.
Your son got it?
Yeah, and then the doctor gave him a rinse with
Miracle mouthwash.
yeah, something like that.
And it's
And
got
then
steroids and
lots of popsicles.
Yeah.
He would eat popsicles like for the veins. Terry was like 4. I can't eat.
it hurts.
But that's what.
Imagine having more of those. So you can have them on the lip. Again, they're minor. Or when they get bigger, then you get big lesions. These are really painful. About 10% of the cases, those are major recurrent aphthous ulcers. Really deep ulcers, and it usually takes 10 days or more to heal. Some of these patients that I have, there is a medication, because they'll feel it coming on. They'll feel like a little itchy or tingling, and they know when they're stressed or if they're out in the sun too long, and they'll take a pill. And it doesn't completely eliminate them getting it, but it does make it less severe. And so I've got a few patients that every now and then they'll call me, "Can you prescribe me more? Because I'm running out." And it's just an antiviral medication. Okay, itis, again, means inflammation. Cellulitis, so inflammation of cells. Or a condition where inflammation is not contained to a localized area and spreads throughout the soft tissue or organ. Cellulitis is characterized by red skin, rapid swelling, and severe throbbing pain. When associated with oral infection, cellulitis is potentially dangerous and can travel quickly, especially when we're getting up into the eye space or the throat. It's really, really dangerous. And I've sent patients from here to the emergency room because they come in. This is, you know, little kid, you can see the left side of the face, a little puffy here, redness around the eye. You know, this needs some strong antibiotics here to try to control it. But I've had a patient who comes in and the eye is like completely shut. You know, those, they need to go to the emergency room and get IV antibiotics and probably surgery. So something like this, we'd probably refer to the emergency room right away. I mean, you can see how you've got all swelling, the whole half of the face is deformed from all the swelling. You know, down the side of the neck, possibly even. So this is really serious. What's that?
That's no joke. I've
No.
had that like from cuts on my legs.
No.
And
Yeah,
like
it's not.
throbbing.
This is really close. I mean, you're too close to the brain right there. It gets past that barrier and you're in real trouble. Okay, so again, the side of the cheek here, or into the throat area, those are going to the ER. You can end up with tubes on the side of your neck right there trying to drain those, and could kill you. This guy's got a tracheotomy, he can't breathe. So those, once they get that big, I mean, a bad tooth, if it's not taken care of, can put you in the hospital and kill you. So it's not something to play with. So it needs to be addressed. It's rare that I've seen a few cases, and the last one was probably 2 years ago where I sent them to the ER. But you know, normally you'll have some swelling and you can treat it with antibiotics, then they come back and you take the tooth out, or they have a root canal or whatever. But when they wait too long, they show like that.
Yeah, because you can't amputate your head.
Not,
Because I had a lady come in, like the ER she was diabetic, and she had cut her foot, and the cellulitis was getting really bad, and she waited till red streaks were going all the way up past her knee, and they had to take her right to emergency surgery and take the whole leg.
Yeah. So white sponge nevus is a rare inherited trait that presents as symmetrical white lesions with multiple furrows or little crevices and the spongy texture. The lesions appear at birth and early childhood. Most common locations are the inside of the cheeks and tongue, and there's really no treatment. It just looks a little weird. A little baby with kind of a spongy tongue. Or on an adult, you'll see it on the sides. Kind of white patches. Papilloma is painless pedunculated. It's kind of like a little pedestal that has a narrow base and it looks like a little cauliflower. It has numerous finger-like projections that form a cauliflower pattern. Kind of looks like this. Again, it's got a narrow base and then it kind of flowers out. That's a papilloma. Linea alba, this is what you have on the some people have on the side of your cheek. Again, it's kind of by nature that we suck, and some patients continue their sucking habits at night, and you get where your teeth join your upper teeth join your bottom teeth, your cheek gets sucked into that space, and you get this little white line. That's on both sides, a bilateral white raised line at the level of the occlusal line of the teeth, so where the teeth come together. Okay, so this line right through here, some of you can probably feel if you run your tongue on the side of your cheek there, you can probably feel a little raised area there where your cheek kind of gets inside your teeth. Nicotine stomatitis, again, that's just the body's response to protection from heat or from any irritant. So usually in the hard palate and the roof of your mouth, from pipe or cigar smoking, and even cigarette smoking will cause it as well. So the temperature of the smoke and the appliance causes this condition. The palate is initially red and later becomes wrinkled and diffuse whitish gray color with numerous inflated salivary glands and ducts. The treatment is to stop smoking. Okay, so again, you can see all these little salivary ducts up on the top of the roof of your mouth there. You can see the actual ducts there and all that white extra tissue that the body's trying to protect itself from the irritant. Fordyce granules. I don't think this is on your notes. This, but it's on the test, and I don't know why they're off of your notes, but so Fordyce granules are, this is what you need to know, visible ectopic sebaceous glands. Ectopic meaning they're all over the place, that are present in most individuals. So write down Fordyce granules are visible ectopic sebaceous glands. Sebaceous meaning they secrete serum. Treatment, so just the visible ectopic sebaceous gland. Okay, so then if you pull on the side of the cheek or the lip, you'll see these little white patches, and these are just again little glands there, and sometimes even on the border of the lip you can see them. Some patients more than others. Leukoedema or leukodema, okay, depends on what you're reading or where you're reading. They're spelled different, but it's the same word. It's a grayish-white opalescent pattern of mucosa with a slight wrinkled surface. It is harmless and very common condition. Leukodema? You stop at I? Alright, so J and K. Let's see why it gets cut off there. So it's a grayish-white opalescent pattern of mucosa with a slightly wrinkled surface. That's what you need to know. Again, these are matching, I think. A grayish-white opalescent pattern of mucosa with a slightly wrinkled surface. Grayish white is the key. Grayish white. Got it? Kind of again, sort of like that. Kind of grayish white wrinkled. Okay, conditions of the tongue. Again, itis means inflammation, gloss means the tongue. So inflammation and changes in the features of the surface of the tongue. Okay, so glossitis, again, a swollen tongue there, inflammation of the tongue. You can have a black, hairy tongue, thought to be caused by an oral imbalance following antibiotic therapy. The papilla, which are the little hairy fibers on the tongue, there's different sizes, and we'll talk about those, become elongated and resemble hairs. These papilla get black appearance after getting stained by food or tobacco. So it can look like that. So that would be a black, hairy tongue. There's a brown tongue, and that's nasty. Yeah. Again, a lot of tobacco users or cigarette, you'll see that. This is pretty severe. Usually it's more like this, kind of a orange, lighter colored brown hairy tongue. Geographic tongue, again, we don't know what causes this, either stress or something, a benign condition where bald spots with whitish margins appear on the surface of the tongue. These zones migrate, why it's called geographic. Looks like a map across the surface of the tongue over a period of days. So if you were to take a picture of that patient one day of their tongue, you come back, you know, a few weeks later or their next checkup appointment, you take another picture, and it probably looks different. So good.
For instance,
Your tongue.
after I got pregnant and I guess throwing up, I don't know, it changed it.
Yeah, so there's no treatment or anything. Again, sometimes I've had patients that come in and they say it burns. Every now and then, for whatever reason, we'll give them, you know, that mouthwash that we talked about for numbing medicine. Then it gets better. Bruxism is just grinding till they end up like little nuts. Okay, bruxism is an oral habit consisting of involuntary grinding and clenching of the teeth, usually during sleep. They associate it with stress, but it's just a severe wear of the teeth could lead to problems with the TMJ, the joint. Oral cancer, one of the 10 most common cancers in the world. Most of these types of cancers do not cause pain, and the dentist is usually the first to detect it. And that's why we pull the tongue out, look underneath the tongue, drop the tongue down, look at the throat. In 23, we've been practicing 23 years. I've detected 3 of them. So they're not very common. Normally we'll see patches or redness and we'll refer them and they're nothing, they're benign. So I've detected 3. I think Dr. Cervantes is saying 2 or 3. So they're not, you don't see them a lot, but you know, we still do the cancer screening. Carcinoma is a malignant tumor that invades surrounding tissue and can spread to other regions of the body. The tumors usually first appear as ulcers and are found in the soft tissue of the mouth, including the lip, tongue, cheeks, or the floor of the mouth. Okay, so here's on the side of the tongue there. So that would probably be a squamous cell carcinoma. This is a little bit more advanced. And this is kind of what I saw on one of my patients. And I said, hey, you need to, what's his name? You need to go take a look at that. Didn't check it, you know, here. Came back 6 months later, a little bit bigger. Never checked it. Finally it started bothering him and he went to check it. And I still see him. He's survived so far. They had to cut half of his tongue. So he comes in, he's only got half a tongue. So he can barely stick out his tongue. But it was, you know, about this stage, maybe a little bit bigger when he finally decided to do something. Okay, adenocarcinoma, malignant tumor that originates in submucosal glands under the oral mucosa. Clinically, the tumor begins as a lump bulge underneath the normal mucosal tissue. This would be in the esophagus and the throat there. Again, these we can't see, but you palpate. When we do the exam, we palpate here, and you feel any lumps, refer the patient, they'll scope and possibly find something underneath. Sarcoma is a malignant tumor of connective tissue, such as bone. So osteo, again, bone, sarcoma, a malignant tumor of the bone, affected mostly in the bones of the jaws. The cancer may start in the bones and spread to other areas of the body. So again, you see back here, just the overgrowth of the bone. Squamous cell carcinoma comprises 90% of oral cancers. In early stages, it appears as a white little plaque, similar to leukoplakia, and it starts to dry up a little bit and get crusty. And sometimes, and you see it a lot on lips here, especially in Tucson in Arizona. Okay, so, you know, you start to see a little crusting of the lip like that. And you know, if I see a patient like that, I'll say, you need to get that checked. It doesn't look very good. Or if it gets worse, something like that. But it could be on the tongue as well. Verrucous is a low-grade variant squamous cell carcinoma. The human papillomavirus is thought to be involved. This disease appears as a white mass with pebbly surface. The cheek, palate, and the gums are the most common sites. The condition is most common in smokers over the age of 60. And here you see it on the angle of the mouth right here. Leukemia. Again, this, I think we all know what leukemia is. It's just a cancer of the blood where you have too many white blood cells. Again, normal blood, white leukemia blood sample with more white blood cells. And this is something, you know, we may see in a child that comes in. If we see gums overgrown like this and we don't really know why, sometimes even the parents don't know why. You know, you just say, take them to their primary care physician and have them do some blood work. That you could present something like that. And again, sometimes dentists are the first ones to find out. You see somebody there and you refer them to their pediatrician and they could detect something like that. Smokeless tobacco, again, comes without saying. It is an irritation to the tissue. You will get a white plaque, leukoplakia, in the area that you're putting the tobacco. You'll see it on, you know, a whole bunch of young kids nowadays that are playing sports and they're chewing tobacco. All you can do is tell them to stop. This is what you'll see usually. Just the area of the tissue where they put the tobacco and it just turns white. And any white lesion is a precancerous lesion, and that's why you can tell them. You know, the percentages are that you won't get it, but all it takes is one cell to turn bad, and then you got it. That's a little bit more advanced. You can see it, it's not only on the tissue, but you mess up the gums on the teeth here, where you get resorption of the gums, or recession of the gums, and start to get root caries, and it's not good. Again, you could end up with a resected jaw there, and just recently, I think last year, Tony Gwynn died from it. Again, you can see the side of his face there from oral cancer, chewing tobacco. Diseases of major concern to dental health. Let's see. More slides in there. There's a long picture. No, I went on to finish this. Diseases of major concern to dental healthcare workers. Hepatitis. Inflammation of the liver. Varies severity from flu-like symptoms to fatal liver disease. Okay, so again, inflammation of the liver. Symptoms are the loss of appetite, nausea, jaundice, and fever. Jaundice, again, the liver excretes some bile and you turn yellow in your skin and your eyes. Okay, these types of hepatitis you need to know. Okay, hepatitis A. Okay, this is usually contaminated fork at a restaurant or glass, contaminated glass. It's not a bloodborne disease. Okay, you get it by oral, spread fecal or oral, usually through contaminated food or water. And you feel bad, but it's not too serious. You're just not feeling too good. Hepatitis B, a little bit more serious, okay? Can lead to prolonged illness, including destruction of liver cells, cirrhosis of the liver, and death. A bloodborne disease that can spread at a high risk for people who have had disease and some who have been exposed to the disease but are not actively ill. May be carriers and they don't even know it. Therefore, a patient may appear to be healthy and have no history of the disease, but may be a source of an infection. So that's why all dental health care providers and healthcare in general should have a hepatitis B vaccine, because you get a lot of patients that don't even know they're carriers and you can be infected with it. Again, the American Dental Association recommends that all dental healthcare workers have their hepatitis B vaccine. Has everybody given us their copies? A titer is just a count. Okay, when you get your 3 inoculations and you're supposed to be immune, but if you're not sure, they can do a titer and they just draw some blood and they count the cells and make sure that you've got the protection that you need, the antibodies. Hepatitis C is a chronic disease of the liver, okay, which can be transmitted, again, through blood, contaminated needles, or sexual contact. The carrier's rate is higher for HCV than HPV, and there is no vaccine for HCV, nor is there a cure for the disease. So hepatitis C is, again, and we see hepatitis C patients here all the time. Okay, so you got to be careful. There is no cure.
And there's no vaccination?
There is no vaccination for hepatitis C.
That's why you need to wear the gloves and the mask and the protective eyeglasses.
Okay, some of the ones, those are the 3 that we mostly hear. Hepatitis A, B, and C. There's 3 others that we don't hear about a lot. There's hepatitis D, which is a defective virus. Okay, D for defective. It cannot replicate itself without the presence of HBV. Okay, so hepatitis D needs hepatitis B in order for it to work. So an infection of HDV may occur simultaneously or as a co-infection with HBV, or may occur in an HBV carrier. Vaccination against HB also prevents against HD, because HD needs HB. So if you don't have HB, you can't get HD. Okay. In other words, hepatitis D needs hepatitis B, because it by itself it won't function. It's a defective virus, so it needs hepatitis B. So if you've had vaccination for hepatitis B, and you're immune to hepatitis B, then you can't get hepatitis D, because D needs B to live.
So it's like a boost.
Exactly. It's a co-infection, we call it. Okay, and then the other one is hepatitis E, which is not a bloodborne disease. Again, kind of transmitted through, like hepatitis A, through food or water. This disease is commonly found as an epidemic, okay? Hepatitis E, epidemic. Learn those so you can remember it.
How come we never hear about these ones?
So these you don't really see these in the United States, or and they're epidemics probably in other parts of the world. So that's why they're kind of quiet here. But I mean, it says the disease is commonly found as an epidemic in developing countries. So every now and then you'll kind of read about it.
Do you guys know what fecal matter is?
That's where like people are using the
Yeah.
river to use the bathroom and wash their clothes and get drinking water,
Exactly.
like in India and
Yeah,
Asia.
Or the sewer goes into,
Into Brazil, those sewers that are going
water
to
that
be
irrigate their crops.
in Brazil, all those, they're going to go do those triathlons in the water over there. They're saying they're really contaminated, and there's a risk
I
factor.
remember reading something
I
like
mean, and hepatitis G is another co-infection with hepatitis C. Okay, again, a bloodborne disease that is frequent co-infection with hepatitis C.
So G needs C?
G needs C. Okay. And D needs B. Okay, then HIV. I think we all know what HIV is. It's a big risk, all over the world, but in the United States, 20 years ago, when it first started, it was a big issue. Now you get HIV patients that are just living normal lives, taking their medications, and it's not a big deal. Other than you want to be careful. I see quite a few HIV patients here. AIDS, it's just kind of the end state of HIV. So you can have HIV, but you don't have AIDS. AIDS is the final stage of HIV infection. Once you have AIDS, once you have AIDS, means that you're towards the end of that disease. Okay, so you can have HIV and be controlled, or with medications, but the AIDS is the final stage of the disease, and more than likely you will lose, again, results in death. Okay, so once the individual begins showing symptoms and continues to deteriorate, the patient is classified as having acquired immunodeficiency syndrome. And again, that's usually death down the road.
So they're separate, kind of.
No, it's the same.
But it just gets worse.
It gets worse, exactly. It gets worse.
Yeah, your blood cells stop fighting the infections. Usually people die from like the pneumonia or some other sickness, not actually the AIDS itself. It's just because their body can't fight it anymore.
Exactly. TB, again, we know tuberculosis, it's kind of a aerosol. You breathe it from somebody that's coughing. Again, TB is really resistant germ. So if you get somebody who's coughing a lot in the operatory, make sure you wipe down and wipe down again, because if they do have TB, it's a really resistant bug, hard to kill.
Aren't there two kinds of TB, like TB and like super TV where you have to be in
I
a
think there is
special
a
room.
yeah, I think there is a super TV, but you don't have to know that. Herpes simplex,
You have this page in there twice, right?
Yeah.
The double.
Yeah. That's what I was gonna
gotta
say. I
learn
was
it
like,
twice,
Yeah, that's
study
why
it
we're-
twice,
So, yeah.
That's why we're missing that J going on the other.
maybe. Okay, so herpes simplex is again just a virus. Some of those ulcers that you get on the lips or the tongue or the gums could be from this virus, and we all have the herpes virus in us. It's just a dormant virus, and sometimes when you're out in the sun or you're very stressed, your immune system goes down, and that herpes virus comes out, and you get those fever blisters or eruptions or canker sores or whatever you want to call it. There's herpes simplex 1, and usually is on the lips, recurrent sores on the lips. Okay, so something like this. And there's herpes simplex 2, which is the genital herpes, which we won't go into. And that's it.
That was a lot.
That was a lot. But just what we highlighted, there's a lot of information that we just need to cover, but everything that had a star is what you need to learn. Let's take a 5-10 minute break.
Seriously, my leg is like coloring it, pushing so hard trying to see.